Welcome. My name is Fred Sandoval. I'm the Executive Director for the National Latino Behavioral Health Association, NALBA for short. Thank you for joining us today for our series called Pláticas, Latino Wellbeing During COVID-19. NALBA is a nonprofit agency dedicated to the well-being of Latino families and communities across the United States. Our mission is to address the disparities affecting the behavioral health of Latinos. We're excited to host today's Plática on immunizations and how Latinos and their families can and do take care of their emotional, physical, and spiritual well-being during COVID-19. I'd like to thank the National COVID Resiliency Network for helping make this series possible. Each month, NABA will host a professional expert in public health, behavioral health, and/or the field of medicine to share their insights and information on taking care of yourself, your family, and your community during the COVID-19 pandemic, and then also what additional resources are available to help. So let's get started. I'd like to welcome and introduce Dan Burke. He's today's presenter. And let me just say a little bit about Dan before we actually get started with our questions. Dan has been working in public health since 1990. He came to New Mexico as an intern of the Department of Health from the University of California, Berkeley Masters in Public Health program in 1987. He moved back to New Mexico the following year. He worked in health promotion during the 1990s, was outside of the department for a period of time, but worked in primary care for 8 years at El Centro Family Health Center. He returned back to the department in 2009 as the STD Program Manager, then on to serve as Immunization Manager and Bureau Chief in 2014. We're just excited to have you here, Dan. It's just, we couldn't have had the best and better person to be on today's Facebook Live. And we're going to ask you in just a little bit to say a little bit more about yourself. But let me tell the listening audience what to expect today. So the way the Pláticas work is Mr. Burke and myself will start a series of questions and kick up our conversation. And then we're going to start to receive your questions or your comments on live Facebook. And then I will pose those questions to Mr. Burke and I'll share with him any comments that come in. And this way he'll have an opportunity to interact with the live Facebook audience today. And so we're ready to get started, and let's kick off with our first question. So Dan, welcome once again, and why don't you share with our Facebook Live audience a little bit about your background and the work you've been doing in public health. This way they have a little bit more detail. Go ahead,
Right,
Dan.
right. Well, first of all, good to be on with you, Fred, my very good friend from lots of years back. So we go way back, and it's really fun to be doing this today. Yeah, so I'm 20 some year veteran of the Department of Health and done a lot of stuff. And you just gave pretty good rundown of my background. I don't know if I could do much better than that. But really, I just feel like I mean, I just was in the right place at the right time to be at the center of this whole vaccine thing. Obviously I was a immunization program manager for a few years, and now I'm a bureau chief and I oversee the immunization program. And when this stuff started coming down, I remember, a year ago talking to my medical director saying, you think this is going to be a big deal or is this just going to pass? You think this COVID thing is going to be something, Yeah, it was a big deal. And then, I mean, amazingly, they came out with these vaccines in less than a year, which is just smoking time. It's just amazing that they were able to do that. And we can talk about how they did that. I just want to say they did it safely. They did it by not skipping steps, but just doing things fast. And it's such an amazing thing to be in the middle of this pandemic and having the hope that we've got vaccine. I mean, what were we going to do without the vaccines? And here we are all getting them. So I guess I'll just preface it with that, saying it's just a great place to be seeing the vaccines come up. And New Mexico is like at the top of the country. I mean, literally first or second in the country in every way they look at getting doses out to our people. So I think we have a lot to be proud of with that.
Well, when you're right in the throes of this critical work, Dan, there's nothing like having the leadership that really brings to bear, moving quickly, doing things so that we ensure doing no harm, always addressing the public health and public safety aspects of this work. And it's so great to have you here with us today, because it's going to be a chance for folks to really learn about, not just what New Mexico has done, but in some ways, what's involved with this process, because every state in the union and our territories are all dealing with the same issues, right?
Right.
But as you said, New Mexico should be proud and can highlight a little bit of its accomplishments, and that's certainly one of our questions. But I don't
Yeah.
want to jump too far ahead with the questions, but
Sorry.
it'd be great for folks to know a little bit about the public health division at the Department of Health, because
Yeah.
sometimes we take for granted the work that our state agencies do, and in fact, I remember being immunized back in the 1950s, right, through the public health offices,
Yep.
and it's like we realize, my God, we've been experiencing immunizations and inoculations since we were children, and sometimes as we get older, there are other forms of vaccines that we're taking. So
Yeah.
in some ways, we're really familiar with it, but this is just a different situation. So
Yeah.
say a little bit more about the public health division.
Yeah. Well, like you mentioned, the mission, the mission of the public health division is to promote wellness, to improve the health outcomes, and to assure safety net services for everybody in the state. So basically, we're all about prevention and safety net services. So if everybody else is doing the services, doing the healthcare, that's fine. If there's a gap there somewhere, we're going to try to fill it or make sure that someone else fills it. Like we call that assurance. I've been involved in, and so we've got all kinds of programs. The Department of Health is the largest agency in the state, and we've got everything from suicide prevention to family planning. To epidemiology that sort of counts what all the things happening are and progress. I'm in the Infectious Disease Bureau, so we've got everything from TB, which by the way is still the most deadly infectious disease in the world, and we've got HIV, STDs. We've got harm reduction. We do all that needle exchange out there, so that there's not all those needles lying in the ground, and people have clean needles and don't pass infections. We have hepatitis, and the refugee health program is in there. And I'm probably always skipping one. Well, immunization, of course, the program that I'm also involved with. So we do all kinds of prevention and clinical services for folks.
Well, and it's on the ground, right? My best recollection, but correct me, Dan, if I'm wrong, in New Mexico has 33 counties, and the counties actually host the state public health offices, what we call the county health office, right? And so anywhere you go across the state, both urban, rural, frontier counties along the border, there are county health offices all over the state. So this is really the state in its best form, sitting right in communities, because the folks who work there are from their hometown, or these are the folks that are right there. And so that says something about the relationship between the community health, public health offices and their communities. So say some more about that, because sometimes people tend to think that the state is somewhere far removed, when in fact it's right in their backyard, and we know that, right? But say more about that.
No, really good point. And of course, Fred is always a modest guy, but he was deputy secretary before in the Department of Health, so he knows what he's talking about, actually. We've got public health offices in every one of the 33 counties, and a number in Bernalillo County, a couple in Rio Arriba, more than one in Doñana. And the big counties, we have more than one. So we really try to be there where folks have needs, and be a place where people can come. Obviously, we have WIC, so a lot of women and pregnant moms and breastfeeding moms are out there getting those checks as well as education. So yeah, it's a very frontline service. And yeah, you're right. There's a lot of local folks that are hired. A lot of our places we are bilingual. We have just people who can translate because they speak Spanish as well as English. So we're down in the in the international district in Albuquerque as well. I work with my colleague who's the refugee health coordinator or manager is down there, and we're taking care of refugees and immigrants. So it's really very spread out and just really at the grassroots level, I'd say.
Yeah, well said. Well, what's great about our Pláticas, Dan, is that we get to have conversations with folks just who are right on the ground or in roles such as yours as the vaccination manager for the state. I mean, how wonderful is that to be able to share with the community the work of the state through the public health division and your role, so
Yeah.
people can hear that. But we also broadcast this out nationally because we're part of something called the National COVID Resiliency Network,
Mm.
which is a huge project
Wow.
undertaken by Morehouse University in conjunction with the Office of Minority Health, which is also at the Department of Health, right, here in New Mexico. So
Okay.
it's great to be able to share this because uh, this is about getting the word out, communicating, sharing about the messaging that's going on. And so, man, we're just excited to have you, Daniel. It's, you're a
Yeah.
trustworthy state public servant. And what that tells folks is that one is what you share with us today is going to be very powerful. And so tell us a little bit about, the state's plan to immunize our residents. What's happening?
Okay. Okay. Well, as soon as in August, the CDC said, "Hey guys, for real, we got vaccines coming, so start planning." We pulled together a big planning group, so we got together everybody from all different parts of the healthcare world, and tribal folks, and just all kinds of people, and we put together a pretty good plan that had to get submitted. And then the doses started rolling in like December 14th, Pfizer came along, and then Moderna the next week. And we really emphasized, first of all, partnership. Like nobody can do this alone, nobody. So we've got partners we started with hospitals, obviously the public health offices, pharmacies, the community health centers, the FQHCs,
Right?
which are all around the state. We've got a great network of everything from La Familia Medical Center here in Santa Fe to First Choice in Albuquerque to El Centro, all over the state. So those folks are doing, and by the way, not all states have done that. So we hear states where like they're not even working with their federally qualified health centers. So like, why would you not work with them? So we are,
Right.
we get on every week too. We have like office hours with the hospital association and with the primary care folks. And we get on there and we talk to them, and here's what's going on. Here's what's happening. Watch out for this. And, so it's as much as we can, it's a really big partnership. We've got, I don't know, about 250 providers now all over the state that are given vaccine. And there's more that are lined up to give vaccine, but we just don't have enough vaccine to go around yet. The vaccine numbers have been increasing gradually. The Pfizer's increasing every 2 weeks. I think we get like 4,000 more doses. So it's been tight. It's been like not enough to go around. And I know a lot of people are really waiting for their vaccines. And, sometimes we feel a little impatient, like, where's my vaccine? How come they all got it and I didn't get it yet? We are trying to
Right.
do it as fair as we can. I promise you, people. It's not easy because everybody's trying to do a movida if they can to get in there one way or another. But we're trying to just do it really fairly. As I'm saying, we're working through phases. So our first phase was healthcare workers and long-term healthcare facilities. So that's your nursing homes and your assisted living facilities, right? Those are our viejitos that are more vulnerable. You know, if they get COVID, it could be very dangerous for them, right? We know that, and a lot of folks have died, unfortunately. So we really tried to blanket those long-term care facilities and then the healthcare providers. So, well, you know, they're protected. Now they can go out and vaccinate you, and they're not worried about getting sick as much, right? So that's it. That was that phase. Now we're in the next phase. And so 1B, we call it. 1A was the healthcare providers and long-term care. Now we're in 1B. So that means, first of all, the oldest folks, the 75 and up, their priority right now, still today, if you're 75 and up, we're going to try to put you first in line. Secondly, we've got the younger group, the 16 to 74, but with chronic conditions. So, you know, heart conditions, diabetes, Alzheimer's is in there, dementia, a number of conditions. It's on the website. You can look it up. And those folks are next in line. That, though, I was telling Fred earlier, that is a big group of people. I mean, there's a lot of people in the state that have chronic disease, and so they're all like on the waiting list. They're all in the waiting room, I call it. So, you know, I know it must feel frustrating, but we are, like I say, we're getting more doses, and it's going to keep increasing. So take a breath there, and lots more to say, but
Sure, sure. No, yeah. Well, you very succinctly kind of went through you know what's happening right now, and that's important for folks to hear that. And in fact, I do periodically will be asked, well, have you had your vaccine, and have you been immunized? And of course, I'm already on the list, and it's very telling. Here's the sense I get, Dan, out in the community, is folks are very anxious to be vaccinated. Anxious, but in the way that, in other words, I want to be vaccinated now.
yeah,
I want to get vaccinated. It's that kind of anxiousness, right? And so that's a positive sign because it means that folks want to have that additional sense of security, that assuredness, that comfort that they're doing everything on their part, personal responsibility, to be vaccinated. I take that as a powerful message. And, you know, it tells me that all of us who are in partnership working together to message people's health and well-being is so vital to encouraging people to get vaccinated. The challenge is, as you said, there just isn't enough of a
yeah,
supply yet.
yeah.
But you know, what do you foresee happening with maybe additional new vaccines,
Right.
the volume of vaccines coming in to give people hope, right? Because here we are anxiously waiting, you know, which is a good sign, but how do we
Right.
address that?
Right. All right. So we've been getting about 60 to 70,000 vaccine doses each week. Okay. So about half Pfizer and half Moderna. Next week, we're going to get a brand new, if all goes according to plan, a brand new vaccine. It's called Johnson & Johnson. The great thing about Johnson & Johnson, it's a one-dose vaccine. You know, Pfizer and Moderna, you have to get 2 doses, right? Well, that means double the work for the healthcare system. It double the time for people to travel and get vaccines. Johnson & Johnson, one and done. You get 1 dose, you're vaccinated. So we're really excited about that. And we're going to get that out, you know, starting next week. We're going to start getting it out to the providers who can get it out to the people. So, you know, that's going to be a real big help. We're getting like 17,000 doses this first week. We're not sure the supply after that. It's going to depend on a lot of things, but it's really good because that increases our dosage that's available to vaccinate people. And then the next one we're expecting after that, there's a couple more. There's AstraZeneca, and there's Novo. I'm spacing the name. Something like Novax or something like that, I think. So
Okay.
we'll have like 5 vaccines by the summer. So hopefully, what that means is we'll be able to really give anybody, you know, the line will just open up much wider.
Well, that's great. Well, you know, I just want to quickly let you know that folks are commenting on Facebook Live right now, and
Right.
I'm going to do a quick shout out for our colleague Dr. Rocky Romero, who sends his regards, Dan. We also have Lori Alcalá. She's up in Española, up in the Rio Arriba County area.
Sure.
Bonifacio Gutierrez says, "Good to see you guys working on these topics." And I want to say thanks, Bonifacio, for joining us today. We also have a colleague from San Diego, California, joining us today. So he's joined us, and we'll have some folks here who will continue to either be watching, comment, and I want to welcome Lori for Trujillo Pike for joining us today. So, she lives right there in the Nambe, Santa Fe area. So it's good
All
to have
right.
folks from different places in the state and even outside of the state listening in.
Interesting.
So if you were to tell folks how we're progressing, say a little bit more about, something you said at the very beginning is you were saying New Mexico is doing really well.
Yeah.
And that means um, several things, such as it means we're getting more people immunized, one,
Hmm.
and then it's probably reducing hospitalizations and it's
Hmm.
probably also reducing deaths.
Hmm.
So tell us about that because
Yeah.
part of the hope, I call it the light at the end of the tunnel, is
Yeah.
that oh my gosh, the more of what we're doing to get us all vaccinated is going to help us. But tell us about this progress because I think there's something that
Right.
we should learn about that.
Well, we just celebrated the 500,000 milestone of doses administered. So we count how many doses got in arms. So we're at about 520,000 now today. When you think of the state's 2 million, so that's a quarter of that. But of course, you got to divide that in half because you need 2 doses per person. I think we've got about, I don't have the exact numbers in front of me. We got about 300,000 first doses, and then we got about, close to 200,000 second doses. So those are the completely immunized people. One thing I want to just really emphasize, get that second dose, right? If you're getting Pfizer or Moderna and you have that first dose and you didn't get that second dose, find a way to get back in the system and get you that second dose because you're only partially protected. Um, really, really want to emphasize you want to get that 95% protection. You got to get that second dose. So we prioritize the second doses. We call them booster doses. So if a provider is asking for, you know, uh, uh, doses, we will fill those booster doses and make sure. So we guarantee the provider is going to have enough. So we want everybody to get back in there and get those doses. So that's some of the progress. You're right. The infection rate has fallen way down. Right now, every day we see 300, 400, couple hundred, new infections. I mean, I remember just a couple months ago, we were at 1,000, 1,500, 2,000 a day. So it's really, really gone down quite a bit. Now, there's other things going on, the season changing, there's natural ups and downs, but the
Right.
vaccines and the number of people that have been infected already, right? So if you add the number of people who have been infected and recovered, plus the number of people who have been vaccinated, now that's your number of people that are, resistant to COVID. So anybody that's not sure that COVID, that the vaccines work or that it's real, just watch how the numbers have gone down.
Yeah, that's right. And it's great to see so many folks sharing this information, not just on television, on the radio, the print media, social media. And there's no doubt that when we hear things progressing, one example of that is, I believe, and correct me if I'm wrong, but I believe the department came up with this
Oh yeah.
green, red, yellow method.
Uh-huh.
And so tell folks what that means because, we can assume we know what that means, but say a little something about that.
And now they've added turquoise. Did you check that out? They've actually added turquoise, which is, I think you have a couple of weeks in a row being in the green zone. But yeah, that's just, I think it's percent positivity in your testing. I'm not sure the exact other things, but it's measures of how much your area is, there's community spread and how much that community spread is controlled. And we know that, vaccines are kind of the end game, but the serious middle game is that all the masking and all the distancing and washing hands and all those make a big difference in keeping the rates down. So yeah, so you want to be in the green, or you'd like to get from red to yellow zone, and then it starts opening up what you can do with restaurants and social interaction. And so that's the prize here, right? When we control these things, now we can start thinking about doing things again. So which is pretty, forgot what that's like almost, but we're going to get back there. We are going to get back there.
Yeah, that's absolutely right. Actually, that's a really good point. I know that during the course of our Pláticas, we have different guests who come in. We've had, physicians, MDs. We've had folks who are right on the ground, boots on the ground with federally qualified health centers,
Mm-hmm.
and the folks who really can help give us good quality factual information in a way that people can understand, right? And so one of the things that we're all going to have to start to think about is how do we then get ready to adjust to when COVID has been controlled,
Mm-hmm.
and what are things we're going to do to readjust to being back into the mode of interacting with folks, going to public places, attending events. I mean, there's going to take some adjustment to some of that, don't you think?
Well, definitely. And I mean, let's just say teleworking. I'm teleworking right now. You can see this is my house. This is where I live, and I'm working here. And many of us are doing that same thing. So what's going to happen with that, right? I mean, I think we'll go back to the offices, but I hope we don't totally go back, because I think this has been a huge social experiment with people being able to prove that people can be productive and be good workers. And that's less traffic on the highway, that's less accidents, that's less carbon in the air. So, I mean, I think there's all kinds of things. I think this is a landmark. This pandemic is going to have lasting change to our society and that we maybe aren't even aware of yet. And so, yeah, some things maybe go back to like they were before, but a lot of things are going to stay changed, maybe.
Yeah, I absolutely agree. Well, I better make sure I do my due diligence, right? And so as questions come in, I want to make sure we pay attention to that.
For
So just
sure.
very quickly, if I can.
Sure.
Um, so we have a colleague down from Bernalillo County,
Okay.
and who's sent us a message, and we have Gloria who wants to say thank you for this helpful information. So this is precisely what our goal was to be able to get the right information from the right people, so that our community can feel increasingly confident that what you're hearing, especially from leaders like yourself, is that this is going to improve the circumstance we're all facing. But I do have a question here, so I just want to make sure I pose the
Sure.
question.
Yeah.
It says, are the known side effects more intense compared to the other brands? And an example was 2 shots versus 1 shot. So,
Yeah.
in the Department of Health, you have a chief
Yeah.
medical officer, you have several physicians that are part of the team. And
Yeah.
so, what are the doctors telling us about that, about
Right.
those side effects? What are they
So
sharing with you?
and we've talked to a lot of people. I mean, there are side effects. So let's separate out sort of the serious versus the just nuisance. Okay. So I mean, mostly for Pfizer or Moderna, you're probably going to get a sore arm. I mean, that's almost a given. And then you might get, and Moderna's second dose is probably the more intense, more than Pfizer. Okay, but really those side effects are all that is. That's your body's immunization, your immune response kicking in. You know, so it hurts, but just think, okay, this is me getting immune to COVID. And it is a sign that it's working. So that's what's happening. It's your immune response kicking in. So you can get, just body aches. You can get fatigue. You can get headache. You can have fever and chills. Those are kind of the most common things. But they're all usually, you take some Advil and it passes in a day or two. Now, let's look on the serious side. So there are very rare but serious side effects, and what those side effects are the is the immune response. The God, I'm spacing the name here. Help me out, Fred. What's that called? The anaphylactic response. So people who, gosh, getting old here. People who are have those kind of anaphylactic responses to other medications or other vaccines, or certainly if they've had it to like a first dose, we're going to say, be really careful. Talk it over with your doctor. You might still get it, but you want to get it probably in a medical setting. And basically, it's an EpiPen. You want to be around with someone that has an EpiPen that's going to stop any allergic reaction if it happens, because that could be serious. What we do is we observe everybody for 15 minutes after their shot for any kind of reaction. But if you've had a history of serious, allergic reactions, we're going to watch you for half an hour, and that's the guidance, and that's what people are doing. I heard there were, like, in the first 2 million in the country, was a long time ago, I think there were 21 of those serious side effects. So it's mostly just, nuisance.
Got it. Very good. Well, I have a couple of questions that came in, so I want to make sure you kind of get a little breather there and get hydrated, because these next two questions are very relevant to what we are hearing about. One has to do with testing, and then the other one is having to do
Okay.
with, of course, the vaccine. So let
Okay.
me ask you the question that's just come in through Facebook Live. The question is, will COVID testing continue once all the vaccines are distributed?
Yeah. So, I don't know for sure the answer to that. I'm going to say that so there's a period of time where we're seeing, like, these are brand new vaccines. So I mean, we know the studies, but we're still seeing longer term effects. So they're still keeping on a lot of the precautions, the masks, and like the testing. They just said you don't have to isolate if you're vaccinated and you're exposed, and you're exposed. So they just removed one precaution, and I think the precautions are going to get reduced over time when they see how people are in real life are responding, and how they're getting responding to the possibility of infection. So I think they're going to keep testing going, especially we've got the unvaccinated folks, and then I think it's going to diminish down to pretty small, just like they test for strep throat or something. It'll be a much smaller operation in the future.
That's good to know. And this second question is very telling about there has always been individuals in communities across the U.S. who have things like you just said. They may be allergic to certain vaccines, and so the question that we've been asked is, what can be done for folks who can't have the vaccine due to medication and or food allergies? And so there's always a segment of the
Yeah.
population, right, that fits that description. And what have been some of the internal conversations about how to address that group of individuals,
Right.
and it's not by choice. They have certain reactions that are significant, and it's kind of, as you said, making sure that you provide additional observation for folks who
Yeah.
do take the shot. But what about the folks who
Yeah.
don't take the shots, who have these allergic reactions already, known
Right.
reactions?
Right.
And what are some of the things you're all discussing about that?
Yeah. Well, number one, you know, food allergies and medications are not really contraindications. They're not really something that says you can't have it. So if you have those, don't assume you can't get the vaccine. Go talk to your doctor, go check it out, because there are very few people that cannot get the vaccines. And the next thing is, okay, this next vaccine, these ones are the messenger RNA vaccines. They're very, 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 very effective, and they have their profile for side effects. Well, Johnson and Johnson is a different technology, and these coming other ones are different technologies. These are based on actually the vector is an adenovirus, which is like a cold virus. So that's what they use to get you in to attack, to the body's immune system. So I'm going to just say, don't assume that those things do not allow you to get the vaccine. I think very few people really, really, really can. Now, if they can't, I guess we're going to have to depend on herd immunity, right? If we get enough people in society vaccinated, it's like measles. Like if you have enough kids vaccinated with measles, the few kids that are not vaccinated, they're surrounded by people who can't pass it along, so they're safe. So that would be the next thing, would be getting enough people in the society vaccinated that people who are not vaccinated are safe.
Got it. Got it. Well, gosh, we're just moving right along, Dan. This has been great to get folks asking questions and making comments. And one of the questions I have for you is, it's, just as you shared with us kind of the progress we're making and the things that really are in store for us,
Yeah,
there's probably been some challenges along the way, right?
sure, sure, sure.
And in terms of, who seems to be experiencing these challenges, what have we learned at the state level about these barriers and challenges, and
Sure.
what baby steps you're already thinking about taking to help assure that some of those things can be mitigated? It's
Okay,
another kind of fancy word for trying to help reduce those things from happening.
for sure. Well, our biggest barriers, I'd say, is, we've got some people who have, what we call vaccine hesitancy, right? They're just, they don't think they want to take the vaccine. Now, back, before the doses started coming, it was like 40%, 50% were saying, no, I don't think so. Or they were saying, you know what, I'm going to let you take it first, and then I'm going to see how you do. And people have done
Right.
that. They really have
Okay.
done that. And then it's down now to like a quarter of the country saying, "No, I don't know that I would take the vaccine right now." Quarter to a third. So it's gone down, and that's a good thing. So I think just need to keep trying to talk to people. Some people are never going to get it. Some people don't believe in vaccines, and they won't. And it's a free country, right? That you get to do that. Um, but I think that's one of our biggest things. And then how well are we communicating to people on that? So I think we can always do a better job of communicating and in different languages, and reaching people that need to know. Um, there are also barriers. So we have this registration app, right? So you register, you get on there, and they say, okay, you're registered, and then you're waiting your turn to get invited to go to get your vaccine, right? And people are waiting. Now, for some of our more elderly population, or maybe people that are on the other side of the digital divide, they don't not real great with computers, or maybe they don't have a smartphone. My
Right.
mother-in-law still has the old flip phone. You can't really text her, right? She can't get a text. She got a vaccine already, but that's okay. And so, that's a barrier, and we're really trying to reach out with those people. We have people lined up in like call centers that are trained to call those people and get them scheduled the old-fashioned way, just by a landline and stuff like that. I want to say something about that. If you have, your abuelita or your somebody in your family who isn't really good with the computer, or doesn't have one, doesn't have an email, you can register for that person. So I could register for a number of people. In fact, my wife registered for me, and you can do that for another person. And then you would have the email. You just then would have to let the person know, hey, you got an appointment tomorrow at 9. So you can help out your family members that are not real slick with computers by registering for them and being their kind of conduit, being their pathway to getting in there. And what else? I mean, those are kind of some of the key ones I'd want to touch on.
Well, that's great. I do know that there's there are unique aspects to New Mexico that most people aren't familiar with. It's the fifth largest state in geographic size in the
Yeah.
nation. So what happens in the northwestern part of the state is very different than what happens along the border of New Mexico and Mexico.
Yeah.
And it's certainly different on the east part of the state, where we have a lot of ranchers and farming communities and
Yeah.
dairy farms, and then compared to, other parts of the state. And when we think about which particular racial or ethnic groups are being impacted by this, a lot of the national data tells us that in large measure, Latinos and African Americans have been significantly impacted as it relates to COVID. And having said that, um, are there any particular messaging techniques that the department is using to help ensure that the messaging about testing and
Mm-hmm.
vaccines is shared in Spanish or in Navajo or in Vietnamese, given these are significant languages in New Mexico, right?
Yeah.
Because question would be is how do we get information? And like you said, it's important to communicate with the providers, the practitioners, the public, and what are some of the things you're currently doing that help to ensure people know what's happening next? Because
Yeah.
um,
Yeah.
I do watch TV, I have to admit, and so we get little blurbs of information, right? Unlike having an hour of quality time with you, my gosh, this is like incredible. This is like a mega dose, right? But what is the department doing to help ensure messaging to different racial, ethnic, and cultural groups across the state?
Yeah. So good question. And it's really interesting. I'm actually looking at race and ethnicity um, percentages of population getting getting a dose. And of course, first of all, the data is so-so because a lot of people don't answer, but American Indians, Native Americans are doing quite well. They've got like a quarter of the population have gotten a dose, and they're kind of the highest group in the state. Um, uh, Black African American are at the lowest. They're at 10.5% of the population that got a dose, compared to 25.5 for Native Americans, and Hispanics are at 14%, and whites are at just about 20%. So kind of interesting numbers right there. Um, so it's interesting. So we have a grant. We got this nice grant that's due Monday, by the way. It's a huge grant, actually. It's the biggest grant I've ever seen out here. I'm not going to say numbers, but it's big. And we're
Yeah.
putting in there a couple of $1 million for community health workers. So you know all about that, I'm sure. I know you do. Community health workers and promotoras and community health representatives in the Native American population. So we're going to put a lot of money into hiring some community health workers, and basically run by folks whose whole job is to increase equity in the state. We've been identified by kind of the statistics, the areas in the state, the smaller areas that have the lowest, social equity kind of, and try to focus in on those areas, and really increase more doses, give more doses to providers in those areas. So those are a couple of things that we're trying to do um, to work on that.
That's great. Yeah, that's absolutely right. Community health workers have historically been very important to local communities because these are lay folks, folks who are largely paraprofessionals, but they're so trusted in their communities that people know they're going to be helpful, they're going to be informative, they bring them information, they help connect them to resources. So they're really well respected individuals who people trust. And I think that's a very significant strategy for being able to increase people's trust in public service, right? In other words, the
Yeah,
public health of our state is contingent on people receiving help that's accessible to them and that's also accepted by them. Because it's important for us to message something that sometimes people ask, well, do I have to pay for the vaccines? Right, it's a big issue, right? Because
right.
people may not know, right? So as we think about New Mexico in terms of its population and its characteristics, almost probably almost a million folks are on Medicaid,
Yeah,
and so what we
yeah,
realize is that those are folks with less income. And so
yeah,
say a little bit something about ensuring that the message about not having to pay for the testing or
for sure,
immunization, so that
for sure.
then people can say, good, that's one less barrier.
Yeah,
That's one less thing I have to worry about. Because
yeah,
worry has been the number one issue in the Latino communities. People are very worried about what's happening.
yeah, yeah. Interesting. Well, thanks. Yeah, no, you do not have to pay. It's that people cannot charge individuals. They can charge insurance companies. So they will ask you, providers will generally ask you your insurance. Um, and they may be, and they'll bill insurance, but you can't be charged a copay. This has got to be free to individuals. And I think the federal government got it right on this one. So first of all, we've already paid for the vaccines, right? Because we pay taxes, and this is paid for by the taxpayers. We've already paid. We've already bought those vaccines, so that's pretty cool. And yeah, folks that are uninsured, the provider has it can apply to a fund to get paid for the administration of the vaccine, not the vaccine itself, but the giving the shot. But they cannot charge the individual. If they are, they're
Yeah,
scamming you,
thanks for
and that would be something to
uh,
report.
yeah, that's absolutely right.
Yeah.
And what's great, the Department of Health has not just the local offices that people can contact, but the state also has provided a number of toll-free numbers for people to reach out to and to contact, and it's a way of ensuring that people can call and ask questions about screening or about vaccines,
Yeah.
and to be able to help themselves and help their families, given how significant we feel about that. So let me ask you a couple other questions, Dan, before we start to wrap up. My God, we're just moving right along here. I'm just thrilled that you were able to join us today, and yeah, more importantly, share all the information that you have in such a cordial and warm way, because it's a reminder that our public employees who are working hard, not
Mm,
only as the essential workers, right, in the field offices, etc., are being supported by those who are in administrative and management roles and in leadership roles, all the way up to the governor's office, right, and to the
mm,
secretaries of the department.
mhm.
We're all, as you said, working in collaboration and partnership. And I tend to use that proverb often enough to remind people that we, in particular Latinos, believe that collaborating is important. And we said, like in this dicho, right, which is una mano lava la otra y las dos lavan la cara, right?
Mhm.
Both hands wash each other and both hands wash the face. And that's really the goal here is how
Yeah,
is it that we
yeah,
take care of others? And in this case, it could be our parents, it could be our grandparents, our godparents, our kids, of course,
yeah,
and in our communities, because we're all in this together. We're facing this pandemic as a community.
right.
Each of us are reacting to it differently given the circumstances of our support systems and resources. But thank you so much for talking about what the department is doing. But if you were to want individuals who are listening in today to take away a message, not only what would that be, but note that we're going to record this session and we're going to replay it so that after today, we'll continue to share this invaluable information to folks so that they can continue to learn more about what's happening, not just in our state, but the type of messaging that you think people should take away from today's session.
Yeah.
What would
Yeah.
that be?
Well, I think in a nutshell, I would say, the COVID vaccines are safe and effective, and we're getting to you as fast as we can. So please be patient. Um, and, you're doing a service not only to yourself, but to your family and your community. When you get vaccinated, you're protecting yourself. So that's good. And you're protecting everybody around you. So each one that gets vaccinated, there's less foothold for the virus to get around. So yeah, like you said, we're all in this together. I mean, we all depend on each other, taking care and getting the vaccine, and wish we could do it faster, but we really are doing it as fast as possible.
Yeah, thanks for saying that. One of our listening audience members actually said something to that effect, and what she said was um, the waiting associated to this in of itself causes anxiety and stress. And what are some things folks can be doing while they are waiting and while the state is waiting, because we're all waiting together? But what are some things folks can do to help kind of mitigate, reduce, and address and cope with, the stress and the anxiety? What are some things that the department is doing or the state is doing? Because, you're working with your sister departments on this, not just by yourselves, right? But I mean, what are some of the things that the state has done to help encourage people to manage their stress and anxiety about what's happening with the pandemic?
Yeah, I don't know if I have the greatest response to that, honestly, Fred, because I think this is one of the biggest things of this pandemic is, we're all, we have less human contact, which we need. We need to hug people and see people and feel people around us. And we're all starved for that, right? And many of us are working way too much, and others of us are not working enough, or don't have work. So I think it's a just highly stressful environment. I gotta just say, we gotta, for me, I guess I would just say, just we gotta be kind to each other, and do our best to, to be patient and caring with each other and understanding. We had a meeting with our regions, our different regional directors, and one of them kind of just, like lost it a couple weeks ago. Just kind of, vented, just kind of
Yeah,
blew off some steam, and afterward he emailed around and apologized. I'm sorry, and we all just said, for what? It's okay. We'll all take our turns blowing off a little steam. I think we have to cut each other the slack and know that these are hard times. These are really hard times, and all we can do is just be supportive. And that's my personal answer, but I'm sure there's a million other thoughts that could be expressed there. Playing
sure,
music,
absolutely.
walking.
Yeah, that's absolutely right. There are those kind of personal activities we can engage in individually, right, to help us with the stress and the anxiety. And you're absolutely right. Ensuring that we're sleeping well. Sleeping well is very significant, and so part of that is ensuring that people are getting ample rest. That there's, you said, staying hydrated, eating regularly. I could tell you where I live, uh, folks are walking
Mm-hmm.
in this area. It's part of a rural community, so what happens is there's not a lot of traffic, so we don't have sidewalks like they have them in cities, right?
Yeah.
But you have a lot of folks who are walking
Uh-huh.
every day, and it's great to see that because we live in a contemporary society where unfortunately there's a lot of sitting that's associated with
Yeah.
our lifestyles. But I've seen a lot of folks who are going hiking, who are walking. So that means, and walking is a great stress reducer.
Oh,
And the whole idea is, guess what? Our phone devices, right? You can you can call anyone, right? Even with a little flip phone, right? There's nothing like hearing your mom's voice or
mhm,
talking to your dad or
yeah,
calling your abuelita. I mean,
yeah,
there's nothing to prevent us from calling.
yeah,
You have these new apps for how you can actually see somebody, FaceTime, I think they call it, or even Zoom. So you can actually see your family members
mhm,
on your handheld devices.
yeah,
And
yeah,
Latinos, for instance, use these devices a lot. So calling people regularly, but maybe more importantly, is talking about how we feel. Because talking about how we feel lets us diffuse the way that pressure builds up, right?
yeah,
So that
yeah,
to prevent somebody from just blowing off way too much steam,
yeah,
whole
yeah,
idea is, if we talk more about how we're feeling, you'll be surprised how quickly that relieves some of the pressure and the angst that you're feeling, right?
sure.
Because we all have good friends, we all have good buddies, we have relatives, people we know and trust that'll keep it in confidence. And part of what we're simply doing is just trying to cope and manage for a circumstance that we are feeling pressure about. So I really appreciated the comments that were shared. Just we're gonna just a couple of things here real quickly. Jeanette and Nathan joined us today on Facebook Live, and they said thank you for all that you do. You're doing a great job. So, really, again, Danielle, it's just been wonderful to have you. I think that when folks get to hear a state official like yourself to come on live like this through Facebook, it just says how much you value being able to
Mhm,
share this information.
mhm,
And you said it in a way that was understandable. And all I could say is, I'm so glad that you were here with us today. And congratulations on getting the state's vaccination plan implemented
yeah,
and continuing to work for the public in a way that helps ensure that we're taking care of the public health and you're doing in a way that I want to say thank you personally as a
mm,
colleague, a cohort, a friend. I'm a former state official, of course, but the whole
mhm,
idea is to give you an opportunity to talk about the great work you're doing, and I want to personally recognize you for that. And
thank you.
so why don't you close us up with your final comments, Dan? And we're gonna shortly after that, say goodbye to our listening audience. And in case anybody also pops in a question or a comment here before you
Yeah.
leave, I'll bring that up. But why don't you wrap us up, Dan?
All
And
right.
we'll today's Plática.
All right. Well, thanks so much, Fred, for having me on. And what a fun time to just be able to sit and talk with my friend. And we don't get to see each other that much, so this is really a pleasure.
Yeah.
This is helping my health right here. My blood pressure is down from what it was, but other than that, I would just say keep the faith. We're getting there, you guys. We're gonna. We live in an amazing time. I mean, think of this. This would have been the plague in the 12th century, and just everybody would have died. A lot of people, and here we have this amazing technology, and I just feel like blessings for it. Um, and so, yeah, just stay positive, and we're gonna get out of this. And it's not gonna be. We may still have to do booster shots and all that stuff in future years, but we're gonna be okay. So hang in there, and uh, we'll see you at the vaccine line soon.
Well, yeah, hopefully I'll be there, and
Yeah.
I'm looking forward to that. And I think you're absolutely right, Dan. Being grateful in of itself is a method and a technique for being able to really envision that what was happening is something that we can manage and get through. And a large reason is because if you think about all the good things that are in our life, the things that we have, the
Mhm.
people that are around us, all the things that don't have having to do with money, right, or having to do with
Yeah.
possessions. It's the mere fact that, my gosh, we get to wake up another day and experience the goodness of where we are, where we live, the people in
Mhm.
our lives, the blessings that are given to us. We're so blessed, and I think just being grateful in of itself is such an expression of how we'll get through this. And I loved your hopeful message in this. And Dan, stay safe, of course, stay well, and continue the incredible work you're doing at the state of New Mexico Department of Health. Certainly, I will want to end with this for today's Plática is that all of us together can make a difference, and to help each other is a wonderful thing to do. Thank you, Daniel.
Muy
It's
bien.
wonderful to have you.
All
We'll
right.
talk again soon.
Pleasure. Bye.
Bye bye.